Hi, I'm Dr. Kenneth Yu, and today I'd like to talk a little bit about the sedation options for undergoing surgery in our office. We have an accredited operating room, and we can do many procedures in our office, provided the patients are selected appropriately, which I'll go into some discussion later. But by far, probably one of the more common reasons we offer deep sedation is for the lower facelift candidate, and even for some mini facelift patients, they may want that as well. But the reason we think it's important to have deep sedation is that the lower facelift is a long procedure. It's approximately 4 to 5 hours long, and that's just really too long a period, in my opinion, for a patient to be lying, sitting still. So with deep sedation, patients are very comfortable. They're breathing on their own, and they're not aware of anything. And we found that patients awaken much quicker, have much less incidence of nausea and vomiting, and they really like the option to come into our private office and leaving in a private manner. Like I said, most of the lower facelift patients, we recommend doing this, but there have been some patients who have a mini facelift will also do this as well. It really depends on the patient's level of comfort and anxiety. But again, it's a very nice option to offer patients. Deep sedation, otherwise known as other terms like twilight sedation or even TIVA, T-I-V-A, total IV anesthesia, is basically a deep sedation where there is no intubation. The patient is breathing on their own. The key drug we're using is propofol. You may have heard that drug. It's commonly used in common procedures like colonoscopies, and so very quick, very safe. But the patient needs to have a stable airway, and that's why when someone comes to our office and has decided to undergo a lower facelift in our office, I have to make sure that they're a safe candidate because there is no intubation in deep sedation, so the patient has to have a good stable airway to maintain it while we give them propofol. And so there are some criteria that we sort of need to look at, and some of these are the BMI, which is basically based on your height and weight, and it has to be 30 or below. Other factors that I look at is the oral airway exam. So I have the patient open their mouth, I look in there, and I look and see if they have signs of potentially difficult airway. Some of the things I look for is how prominent or how bulky is the base of the tongue, and if I see the soft palate and the hard palate. And there's a grading scale called a Mallampati scale that sort of helps us differentiate and stratify patients into potential risk factors for difficult airway. Fortunately, most of the patients who are undergoing facelift are healthy, active, and don't have these risk factors. But if they do, then I typically will recommend them after surgery in the hospital setting where there is general anesthesia, where there is intubation. Other risk factors are snoring and sleep apnea. Obviously, that will be automatically conditioned to recommend you to have surgery in the surgery centers, but also having a history of high blood pressure, having a neck circumference that's 16 inches in females and 17 inches in male. Those are all also criteria that may make one at high risk for having difficult airways. But if you meet the criteria, then we typically would recommend doing the surgery in the office. It's been very effective, very safe, and patients have been really happy to undergo this deep sedation because the recovery is much, much quicker and nicer and more comfortable than from general anesthesia.